Hello and welcome to another edition of the ICA Chirocast. Today on the ICA Chirocast, we're going to do another one of our ICA Sports and Fitness Science Council podcast. Those of you who don't know me, I'm Dr. Brant Hulsebus. I am on the ICA Sports and Fitness Science Council board, and I'm a chiropractor here in Rockford, Illinois. And today I'm joined by a fellow board member, Dr. Kyle Hoeft, who is in Fishers, Indiana. Is that correct?
Yes, Fishers, Indiana, and I've been in this area in northern Indianapolis for well over 25 years, and we've been working with athletes the entire time, among many other patients.
Those of you who've been following our podcast probably recognize Dr. Kyle because he is one of our board members and we've done podcasts in the past. And I came across a really cool PubMed research article recently, and I saw this and I knew Dr. Kyle would like this, so I sent it over to him so we could discuss it. It has a lot to do with young athletes. So a lot of times you hear about chiropractors doing all this stuff with professional teams, but the majority of athletes we all see, and correct me if I'm wrong here, aren't the professionals. It's the everyday high school kids and the local kids from your town, correct?
Absolutely, and we see more and more of those kids each and every year.
This article is PubMed-indexed, which Dr. Dan Murphy told me that's really important to know. It comes from the American Journal of Sports Medicine of 2016, a February edition, and it's about hip muscle strength predicts non-contact ACL anterior cruciate ligament injury in both male and female athletes. It's a prospective study, but this study really dived more into the female athletes. And it's basically today in sporting world, we're seeing young ladies just running, playing volleyball, soccer, whatever it is, and they're not getting hit, but their ACLs are going. And we were just talking about how I got daughters, Dr. Kyle's sons, but every time I go to a sporting event, I see a girl either in a full leg thing from a knee surgery, or I can see the scars on two or three of the girls from having this. So, are you guys seeing a lot of this in Indiana too, of course?
We are seeing it. I see it a lot. I talk to parents almost on a weekly basis about the stresses on not only the ACL, the knee, but also the hips and the ankles. But commonly, we are dealing with ACL type issues. So absolutely.
And this article is unique because it talks a lot about how you can predict whether or not your athlete is susceptible to this injury. They've done a bunch of research and they found there's certain indicators that can indicate your child might be at risk for this. And if we find these indicators, there's a lot of things that we can do to help the child prevent this from happening by getting rid of the indicators. And one of them is very tied and true to what we do. You want to talk a little bit about what we found in this article that relates back to us chiropractors?
Yeah, absolutely. We are the specialists that can balance and properly align the hip and pelvic regions and its association with the low back and the knee joint. More and more information and studies, as you mentioned, are stressing the importance of proper alignment, proper balance to minimize ACL injuries and other injuries similar to that as well. So yeah.
So my grandpa's day, he used to call this thing called tortipelvis. There was an old book, torticollis was in the neck. We hear about that all the time. But they used to call a term called tortipelvis. And the tortipelvis is an interesting alignment thing. Basically, your L1 and L2 will shift or rotate, what we as chiropractors call subluxate. And what happens is it'll rotate either to the left or the right. You look at the x-ray, the spinals will shift this way or shift that way, left or right. And on the anterior, the front side of these vertebrae, there's a muscle called the iliopsoas muscle. And this muscle splits, goes down through your pelvis to your femoral heads, your top of your leg bones, your thigh bones. And what happens is when this rotates, one of those hip muscles gets really tight and taut, and it'll actually rotate the pelvis. Now, what's interesting about this is that sacrum will stay still, but the pelvis will rotate. So usually what we find on the opposite side are really tight piriformis, which is underneath the glutes. When this one gets really hot, it can actually mimic sciatica. They call that piriformis syndrome. But as chiropractors, we're going to today talk about this pelvic thing. We're going to talk more about this iliopsoas muscle, what it does to the femoral neck. You want to talk, Dr. Kyle, a little bit about this rotation and what it does?
Yeah, so when you have rotation of that upper lumbar area, there are many layers of muscle tissue along that lumbar area that directly corresponds to not only the low back but the hip, as you said. So it really comes down to balance and asymmetry. Because of that rotation, you have now introduced asymmetry with the normal muscle tone. And as a lot of people maybe don't know, is that your body is very symmetrical from a biomechanical standpoint. If you divide it in half, uh, a sagittal cut down the middle, you're going to have the very same muscles on the left as you do the right. And so having that rotation, it sets that symmetry way off, causing that excessive contracture on the one side more so than the other. And there you have imbalance. And approximately 80% of your body's weight focuses down in the sacroiliac joints, right in that area. So now your foundation is skewed and rotated, and you're very, very much vulnerable to injury, specifically in the knee area, with a lot of twisting and turning that is obviously associated with many sports.
Yeah, I always find that on the X-ray of the pelvis, we'll actually see it rotated. We'll see a high hip and a low hip, and I like to look at the femoral necks. There's a ball and socket that comes out into the tall bone that comes up, and for me, sometimes you don't see very much neck in there because of the rotation going. I know a great person to talk about this is if you've ever been told you have a short leg or a long leg, maybe by an athletic trainer, physical therapist, or massage therapist. And they say, when you lay down, you had a short leg and a long leg. We learned in chiropractic school that's probably not the case. You probably have a rotated pelvis. And we have mathematical calculations to figure all that out. We're not going to do that today because nobody wants to do that. But we have this mathematical formula that we can do. And what happens is that neck rolls in, and that creates some of that imbalance Dr. Kyle was talking about that creates extra torque. I always say one cigarette doesn't give you lung cancer, one cheeseburger doesn't give you heart problems, but the more you do that, you want to talk a little bit about that repetitive force on that?
So very, very important. As we all know, kids, young girls and boys, are doing their sports year round. So the repetitive stresses and repetitive traumas to the spine are increasing, and triple, 4 or 5 times more than what we used to see 10, 20 years ago, or even less. So that added stress and trauma with those, even if it's just a little bit of rotation, a little bit of imbalance, it's going to make a big difference down the road. And as you said, it's not necessarily one game, it's not necessarily two games, but if you say got a tournament one weekend, 4 or 5 games, volleyball, basketball, for example. And then during the week, you got trainings doing the same motions, same actions, and more games. That's all going to add up, and your body doesn't forget. It has a counter that's going to remember all this stuff, and eventually, if not maintained, it's going to have issues, and it's going to break down.
You said games too. I mean, just practice every day too. On top of that's going to do it too.
Yep.
And one of the actions, unfortunately, that exposes this is doing a lunge. And I talk to a lot of people about lunges, and they look at me and they say, "Well, I'm a pregnant mom with kids. I don't do lunges." I'm like, "So every time you pick something up, you're doing a squat?" And that's when they realize they probably are doing a lot more lunges than they think they are. And athletes are going to do it all the time. I don't care the sport. I had an interview the other day with somebody talking about pickleball injuries. And every time you lunge to hit that pickleball, you leave with the same leg. And if you have that pelvic rotation, you're doing this over and over and over again. It gets to be too much. So I find that these are usually patients I have to take care of almost all season. And once they stop playing, it calms down. Are you have any comments on that?
Yes, very much the case. I experienced it very much the same way. I have a patient right now that I can think of. She has just kind of ramped down her volleyball. She's taken a little bit of a break, and so I'm able to space out her treatments. But while she was in, the busy time when she was playing every weekend, every day with practices and games, she needed to have adjustments regularly every week, and it made all the difference because without it, she was in enormous pain and it affected her play. So, but yeah, now that she's spacing it out, she's taken a few more weekends off, her body's able to heal a little bit and things are calming down.
One of our fellow board members has actually found an adjustment that we can use to actually adjust not just your back, but your leg bone itself, the femur itself, to try to speed up this untwisting so the athlete can go ahead of time. And some of the unique things that we learn in our training as chiropractors that take care of athletes a little above and beyond the normal chiropractic is that we don't like to do a lot of big, heavy rotational forces right before an event or a competition. We like to use more mechanical drops because of the way it stimulates the joint receptors. So before I adjust an athlete, I ask them, do you have practice or a game? They're like, no, I don't have anything for 3 or 4 more days. So then I do a different adjustment than if they have a game that night. And I've done this with the hockey team big time. They love the new adjusting style before a game versus after a game. So it's very important. Anything else you want to tell our listeners that they're looking for a chiropractor for this that they should be aware of?
The biggest thing that I want to share with my families, with young kids, young children, boys and girls, sports these days much more demanding than they ever have been before. And it underscores the importance of body maintenance. And that includes nutrition, it includes sleep, and as we've discussed today, it includes spinal alignment and making sure that the body has proper movement, proper motion, and if it doesn't, it is restored. That makes a world of difference with all of the different sports as well. It's even more important now than it ever has been before. So get your spine checked, get your kids' spines checked. It's you know it's invaluable to keep you in the game and keep you healthy.
And I find that if I'm going to go to a chiropractor that's going to do this, obviously one that's working with athletes have a better grasp of it versus like a chiropractor that takes care of just newborn babies or a chiropractor that takes care of just geriatric patients. We all get exposed to this at school, but there's deeper dives. That's why we formed our council. That's why we have our education things for other chiropractors. And I'd also want my chiropractor to take an x-ray of this area before they just dove in. I think that's very, very important to get a good look at the dynamics. How much rotation are we talking about? A little bit or a lot? And that would also help me decide when I need to come in and get adjusted, how often I need to get adjusted. And your physical therapist, your athletic trainer, they're going to be people that can help along this process, but they can't do the adjustment like the way we can. And I've seen athletic trainers try to do the hip manipulations to try to free some of this up, and they're missing the biggest part of that, and that's the subluxation at the upper lumbar. They're not even addressing that, and they're actually creating that to get more locked up. So this is not something that anybody else can help you with other than a chiropractor.
That's a good point, and I would also like to add a couple things. If you don't have proper x-rays of the area you're working with, and in this case, the lumbopelvic spine, which includes the lumbar area and the pelvis, you cannot necessarily see a scoliosis, a lateral curve. And that, for example, could be very, very important in the technique you use and how you adjust that patient. I've had patients come to me. They've been to a physical therapist who was also trying to do some manual manipulation with no x-rays. And of course, once we x-ray and we find out, well, this was the problem, this is why the patient wasn't improving, the adjustments given were not properly performed to compensate for the scoliotic curve, which can make a huge difference. And that's why it's so important to have an x-ray so you can see that underlying tissue and how best to address it and how to treat it. Once again, uh, an ounce of prevention is worth a pound of cure. We've all heard that before. It really applies to kids in sports these days.
A lot of parents are really worried about whether or not their athlete has a short leg. And again, with our x-ray, we can do it decisively, tell you whether it's actually we call it anatomically short leg or a measured difference. And Dr. Clarence Gonset, a famous chiropractor, came up with a formula for us to do. I don't think we do it by hand anymore with the calculator. I think the computer does it for us all now, but nevertheless, that's a very unique chiropractically trained skill that we have to answer that. So,
Absolutely.
well, I hope everyone enjoyed this podcast. It's kind of fun to take a look at a piece of research and have a couple of chiropractors dive into it and give you our 2 cents on it. Dr. Kyle, I want to say thank you for joining me on this. I think you've liked the research that I shared with you. I think you see how it's can use this in everyday practice to talk to their patients about what's going on. Do you have anything else you'd like to add before we wrap this up?
No, I think just make sure, you listen to your kids, make sure that they communicate with them any little soreness or ache or pain they may have, because that sometimes can manifest into bigger problems. So pay attention to that stuff and make sure you can find a good sports chiropractor in your area that can properly address any potential issues that we discussed.
I believe those philosophy classes we took said pain is a body, something that's a message to decipher what's going on, not to be masked or covered up. So thank you for joining
Absolutely.
us. Hey, we got big things coming the summer of 2027. We talked today about the importance of finding a sports chiropractor and some of the things that the different people on our board know, like whether it's Dr. talking about subconcussive injuries and how to assess a subconcussion injury right in the sideline and take care of them right then and there before you get them back in your office safely and effectively. Whether it's learning how to adjust those anterior femurs, like I just talked about, that was a neat thing to learn. Whether it's about some extremity work, whether it's about the idea that this is how you adjust an athlete before performance, this is how you adjust them after an event, or whether it's just, hey, I want to start working with a local team in town. What do I have to do for a contract? How do I cover myself, protect myself? These are things that our board and our council have all worked through. And so we're bringing this all to you as a one-day conference, a symposium, and we're going to be really excited here. We're doing the final dotting the lines, crossing, signing the contracts to get this all locked down, and we can't wait to come back and share it with you. So make sure you like and subscribe wherever you're watching and listening to this, and we look forward to seeing you more in the future. Thank you for tuning in.
Thanks for having me, Brant.